Hey you guys, this is Dr. Ben Wiese from the Kelowna Skin Cancer Clinic, and today I want to talk to you about basal cell carcinoma. Now, basal cell carcinoma is actually probably my favorite cancer, and the reason for that is it's easier to treat, and of course the most important thing, it's not going to kill you, but still important to learn a little bit more about it. Now, what is interesting about basal cell carcinoma is that it was the first time described in 1824. And as I've said, this is the most common type of skin cancer that you do get. And the likelihood for males getting this type of cancer is 30 to 40%, while for females it's slightly lower at 20 to 30%. It's typically on sun-exposed skin, and especially if you have a lighter skin complexion. Now, the risk factors for basal cell carcinoma is especially those people who have ultraviolet exposure. Specifically also if you are a male and if you have light-colored skin and lighter eyes. Also, those patients or people from a Northern European ancestry or descent, they're also more at risk for basal cell carcinoma. If you specifically are unable to tan, or yes, those patients who are using tanning beds, you are at risk. 70% of basal cell carcinomas typically you will get on the head, 30% on the nose, 25% on the trunk, and yes, you wouldn't believe me, 5% on the penis, vulva, and the perianal area. Now, a lot of patients would ask me, so how does basal cell carcinoma start? And the most important thing is, that's playing a role, is when ultraviolet rays hits the skin, what happens is you get DNA damage. When we get DNA damage, that's the start of that skin cancer that is growing. Now, of course, there's also some very rare syndromes where this is hereditary, where some syndromes like Basal syndrome or Rombo syndrome, where those patients, even if they don't go in the sun or have any of those risk factors that I've described, that they actually will get skin cancer. One of the most important things for basal cell carcinoma is still that cumulative effect of UV exposure, but interestingly enough, also those intense, intermittent sun exposure, specifically earlier on in life, that will increase your risk factors for getting basal cell carcinoma. Again, another more rare group of patients who are at risk for getting basal cell carcinoma are those patients who had radiation, specifically for acne or for hirsutism. Those patients receive very low dosages of radiation, and they are also at risk for getting basal cell carcinoma.